Welcome back to It's Your Case, presented by VetCT.com. I'm Heather Chalmers, your radiologist on demand for this week. Today's example is a 10-year-old lab with chronic front limb lameness that became acutely worse. In fact, the owner reported that the dog was out playing in the garden or yard and suddenly yelped and is now severely lame on the right front. When the dog is brought into your clinic, you do an orthopedic examination and you find pain on the elbow. You have difficulty extending the elbows, and the elbows feel thick or mass-like. Here are both views of the right elbow. This is a somewhat oblique craniocaudal view, and you can see, although often on the craniocaudal view we would aim to extend the elbow, in this patient it wasn't possible. There's lots to see, so take your time. Here's the lateral view. Many of you will have noticed that there are pronounced changes centered on the elbow joint in this case. This may make you start to worry in an older lab that's acutely lame that something terrible, such as neoplasia, could be happening. But let's practice our process for joint-based pathology. We want to determine if this lesion falls into the category of erosive arthropathy or non-erosive arthropathy. Erosive lesions are those which cause lysis of the subchondral bone, and therefore they're similar to aggressive lesions that we covered previously when we talk about the long bones. So even though there's lots to see around this elbow, let's compile our thoughts around C for cartilage. Remember, C for cartilage refers to the radiographic joint space. And what I'd like you to try to do is take the time to trace the radiographic joint space on both views. I see the radiographic joint space here. The margins of the joint space are smooth, so I don't feature them as ragged or irregular. The joint space width is non-uniform. There's also a thinner radiographic joint space here. And of course, there's summation of another edge of the joint space, the edge of the trochlear notch of the ulna here. Let's look at the other view and continue to look through all the changes all around the elbow and just focus ourselves on the part of the process that's C for cartilage, this radiographic joint space here. Maybe you can appreciate that there's a little bit of obliquity, so we don't see that perfect crescent shape, but where I do see the subchondral bone adjacent to that radiographic joint space, again, I think we could agree that it looks really smooth. When I trace this first line that I traced, this kind of curve is of course the distal humerus. The corresponding aspect of the radius and ulna, when I trace, I see a little dip here between the radius and ulna. This is perhaps a step malalignment, which can be a sign of pre-existing elbow incongruity. We talked a little bit about elbow dysplasia a few weeks back, and we know that radiographs are not always accurate for that. You may have also noticed, I'm going to move this arrow, that there's just overall a little more radiolucency in this area. When we talked about elbows previously, we explained how the radius is essentially a straight post that is hugged by the medial and lateral coronoid process of the ulna. That radio-ulnar joint space can become widened when there's degenerative disease present. So some of what we're seeing here is a summation of that showing through. So if I were to conclude about the subchondral bone in this case, I think I would have to say that it's pretty smooth. I had to ignore a lot of really substantial changes on all edges of the joint in order to allow my eye to really focus on that. But I do not see signs of subchondral bone irregularity or subchondral bone lysis. My conclusion, therefore, would be that this represents a non-erosive arthropathy. The most common non-erosive arthropathy in dogs is degenerative joint disease or osteoarthritis. Let's talk about these changes that we see all around the elbow. You can see there's this large spike of new bone here, a very kind of large curved remodeling here, all kinds of changes here on the medial epicondyle, new bone formation on the ankylosing process of the ulna. These changes I would categorize as periarticular new bone formation. Periarticular new bone formation, you'll recall, can be osteophyte and enthesiophyte, and in this case it's definitely a combination of both. Osteophyte forms at a bone-cartilage junction on the edge of joints, where enthesiophyte forms at soft tissue insertions, including joint capsule. So the term periarticular new bone formation is one that you've heard us use before, and I like it because it allows us to talk about changes around a joint without being too specific, as sometimes we can't tell if it's truly osteophyte or enthesiophyte. So for this joint, I would conclude chronic severe osteoarthritis, no evidence of neoplasia. Occasionally, dogs with chronic arthritis can develop spontaneous septic arthritis, so if clinical signs persist, you could recheck the elbow. Few things in life are as special as an older Labrador Retriever. To best serve these patients, let's remember to stick to our process. Use tools such as rechecks or even second opinions as needed, and be ready to prescribe lots of love, TLC, and medical management. Be sure to review the full report associated with this case. Thanks for listening, and remember, it's your case, so please post your questions on social media.